And stay with us. I'm going to have you listen in to the Q&A, which we're going to go right into. And I would ask all the panelists and speakers to come up. I was counting chairs there and thought we didn't have enough, but then I forgot Mildred isn't here. So we're good. And I'll go head over that way and act like a speaker myself. So I think we've got some mics that you want people to go to.
Yes.
Up here, you got a.
We have two standing mics to the left and to the right, and we have moving mics if they are necessary.
Do they need to push their mic to be heard? So I'm not sure a little light or anything comes on, but it's just for recording purposes here. So we're going to be recording this, and let me urge, if you have a question, these are things that end with an interrogative type spirit. They're not a speech. So let's start over there and tell us who you are.
I'm Monty Westerfield, University of Oregon. So I have a question for Ron Stotish regarding your, I think it was the second to the last point on your future steps slide, which you didn't discuss, which was public acceptance. So I heard on National Public Radio, so it must be true, that more than 50 grocery companies have announced that they will not market your product. And so I'm just wondering what your business plan is, and on a much broader scale, in general, how do we address public acceptance?
Thank you. That's a very good question, and I answer that several times each day. In all seriousness, we're the pioneer. We're the first food animal approved by FDA that has been genetically modified. So we're aware of concerns, and we're aware that people have requests for information and so forth. The first point I'd like to make is we also receive inquiries, perhaps 10 or 20 a day, from people who are interested in buying, selling, or distributing our fish. The U.S. market, as I mentioned in my talk, is something around 300,000 tons of imported Atlantic salmon every year. So the market is huge. That's 300 million pounds, 600 million pounds actually. So it's a lot of fish. The campaign to urge retailers not to carry our fish has been going on for more than 2 years. We believe that if consumers have the opportunity to try the fish, and if the fish is available in commerce, people will be able to make intelligent decisions, whether it's labeled or not, and they will be able to try for themselves to determine whether the quality, the price, and the other attributes of the product meet their personal needs. They've already been assured by perhaps the world's most respected food safety agency that the safety and efficacy of the product are acceptable. And all we really ask is the opportunity to compete in the larger commercial market.
Alta, tell them who you are.
Alta Sharo from the University of Wisconsin-Madison. It actually follows on that question about the role of public engagement. The comment at the very end of the presentation about the moths, which, by the way, was wonderful. All of them were wonderful. Thank you. Made the point with an emoji that there was room for more public consultation. Yet it seemed like a lot of it was focused on kind of education about pros and cons. My observation of the objections in both the human and non-human areas is that some of them, no matter how they're discussed in public, are really based on deeper, more principled or spiritual or instinctive levels of objection. So the bottom line question is this: what role should the kind of non-technical objection play? Should public concerns that are not grounded in scientific evaluations of cost-benefit be considered a legitimate basis for rejecting what might meet technical standards of benefit and risk?
Oh, yeah, I guess that's directed at me.
Although I think it affects all of you.
It does. It affects everyone here for sure. And you're right. I didn't mean to insinuate that objection it doesn't have any merit in the public
And
discussion.
I
or
wasn't
that-
assuming you were insinuating any, this is a
Yeah.
genuine question about how we govern here.
I mean, I think it's important to have that perspective represented. So if we went along with the beefing up the Aya Cook suggestion, that in putting together those kinds of committees, that we don't do so in a way that picks and chooses what perspectives to represent on the Aya Cook. I think there's no denying that there are really deep-seated, entrenched objections to this. However many safeguards and however you try to minimize risk and whatever deliberative process you put into it, some people just won't get on board. And that's a fact that we have to contend with, but it's not unique to this. And I think that democratic processes have been designed and implemented previously to develop political processes that are fair and just and representative of those perspectives. And it's certainly not an easy task, but I would just, my suggestion would be that in putting together whatever oversight or governance committees are decided upon, that you don't ignore that perspective. But I'm not sure, whether compromise might be a good model. You listen to it and you sort of try and do a give and take, or there's just, I'm not sure how it will shake out. But if you at least make a good faith effort to put the fair and just process in place, we'll have a better shot.
One comment I would add is that, many years ago, we put together a ethics panel to think about the creation of the first artificial life form, sort of early Craig Venter type experiments. And actually, Mildred was a member of that panel. And it's important to lay out, I think, say for religious perspectives, what's a minority view and what's a majority view there, because it turned out that a lot of folks were saying you shouldn't play God and it's wrong to make life. And yet most of the major religious groups that we talked to didn't have that particular objection. They were more concerned with just application and the purpose for which you were making this kind of thing. So I wouldn't shy away from it. And sometimes I think by getting the objection in perspective, is it a majoritarian sort of point of view? Is it a minority view within a particular religious or maybe a naturalistic perspective? Sometimes you need to set it in context, I think.
So, great question. Just from maybe an industry side, I think it is extremely important that we take into account public perception. It's critical. Whether I might personally agree with a particular idea or not is not really the point. The question is, what's the consensus? And if I were to ignore that, certainly our customers won't ignore that on the industry side, the large national businesses that we work with, and consumers won't ignore that. So I think it is very important. I think it is also important that we don't create a system that effectively gives a veto to what may be a very small and vocal minority. And so I think having, as Carolyn pointed out, having a system that's fair, where people can sort of bring all the science to the table and all the emotion to the table and all their opinions to the table, and sort of work it out in a way that's fair and equitable and recognizes and engages the importance of that discussion, but not giving veto rights to any particular party. And I think it's important, certainly, that the regulatory process take that into account, as well as everybody else involved in the debate.
All right, let me move over here and again ask.
Yeah,
say
hi.
who you are.
I'm Sarah Carter. I'm at the Craig Venter Institute. And this actually builds on the conversation that was just going on. And I really appreciated, too, Carolyn's comments about, in the end, it comes down to trust. Some of the work that we've done, we were talking about how it depends on the purpose and the species and the types of engineering that you do. But in some of the work we've done, we've figured out that what people really want is they want to trust whoever is developing the product. And so it's very, if they trust that person, then they trust that they've used the appropriate breeding technique. They trust that the purposes won't be frivolous or bad. And so a lot of the things depend on the actual integrity of the product developer. And I'm wondering in this space how you guys see that playing out. A couple of you are for-profit businesses, represent for-profit businesses. Others are sort of nonprofit or academic type things. Certainly in the gene drive world, there's really big nonprofits in there. DARPA military funding is going to get in there, and so it's sort of a wide range of actors. And I'm curious about what you think about what role that plays in this discussion, the sort of ethical considerations, but also what role the regulatory system plays in sort of funneling all those different products through some sieve of trust establishment, and how effective you think it can be in that, assuming it does its role properly.
Okay, well, since you mentioned us specifically on the for-profit side, I think we're at a point now where the question is not really about the science. We can do things that are so incredibly unprecedented and so powerful with the science. I think really what a lot of this comes down to is the ethics. And I think it really is, to a large extent, it falls on the regulatory agencies to listen to the different constituency groups, to the scientists, to try and get what are the facts. And really, there's a time where you try and separate facts from opinion, collect all the information, listen to the different stakeholders. Our regulations are a reflection of indirectly what people vote for to elect politicians who then create regulatory agencies and regulators. And so in the end, I think it does fall on the regulators and the people in general who indirectly put them in power to think about the ethics. And from my perspective, we really have, as I mentioned, we have an obligation to now think about the ethics of not doing anything and what that means. And so my hope is that that can filter back to the regulatory agencies to start saying, okay, we have ethical implications on both sides, and weigh that into the balance. And as a business, once and I know that's not how the regulatory system is set up, I want to be clear, it is a science-based system in this country. But fundamentally, once the regulations are clear for business, then we can move forward and we can make decisions as to where to best invest and try and get products to market.
And I'm going to go to Alison, but Mildred, if you want to get into a response to any question, just butt in. Alison.
Yeah, actually, I think that last comment was really spot on in terms of identifying the locus of concern being the practitioners more than the actual practice. I think that we've seen that with embryonic stem cells and other technologies. And so I don't think that relying on regulators to kind of be the mediators of public trust is something we should rely on to the extent that there's eroding trust in government processes. And I think that that the questioner was absolutely right in identifying the need for scientists themselves to become more trustworthy. I think we've seen with other research that people are much more accepting of clinical research if they believe their doctors, for example, are behind it, because they see that there's a trust relationship there that they can rely on to make proxy decisions for them. So I think that scientists need to try to develop similar relationships with the public. That is not just about sort of assessing attitudes, but creating trust relationships.
I guess I do this with some degree of trepidation, but to follow on the point that the regulators are implementing law and doing that in the absence of being able to consider the ethical implications, that they have it's a science-based regulatory system. And I think that those considerations, when they have come to public comment, if you look at the responses to public comment from the regulators, is we can't take that into account. This is a science-based regulatory system. And this is not the only ethical thing that we've ever approved, right? So I imagine, I wasn't around at the time, but the contraceptive pill, I imagine, had a lot of ethical concerns associated with it that had nothing to do with the safety and efficacy of the pill itself. And so it's not a new concept to deal with ethics in the approval of products.
Let's see, over here.
Steve Niemi, Harvard University and the American College of Laboratory Animal Medicine. I want to applaud Dr. Kaplan for invoking the 3 R's in looking at this new landscape. And one opportunity I haven't heard, but I think could be very powerful, is applying gene editing to human cells on these organs on a chip and theoretically create any cellular lesion of interest and making these even more valuable. But what I didn't hear was any mention of refinement, so I'll propose an alternative scenario and would appreciate your response. If we can make animal models that are either more accelerated or more human-like for a disease study and drug evaluation, I think there's an opportunity for refined endpoints where we could see answers sooner before clinical signs become severe in those animal subjects, whether it's Huntington's disease or anything else, and model those. That now pushes IACUCs to become more aggressive in their review of these protocols to insist on perhaps upstream or earlier stage outcomes rather than relying on more abundity or allowing these animals to get very sick. So it's going to be an interesting path to follow, both from the inside and the outside, to see if IACUCs can step up.
So let me take a stab at that one, and I'm going to warn people waiting in line. I'm probably going to do one more on each side and then go to the break because we're behind. But at the break, I'll ask the panelists to stay up here. So if you had a question you wanted to address to one of them, they'll just delay a little bit their bathroom break or whatever they're going to do and answer the question, then they can go. So I think that's a great point. We didn't get into cellular modeling and chip kinds of technologies because we wouldn't have had a meeting, but nonetheless, it's a fair, those models I think are very exciting, very useful, might actually succeed in supplanting some of these animal things. And I agree with you about having the accelerated diseases maybe with biomarkers or other signals that would let you sort of intervene. One thing to think about if you're going to go down that road, having been looking for some time now at compassionate use, expanded access on the human side of trials, the more you sound promissory notes based on early returns on signals about efficacy or safety in animals, the more some elements of the public are going to come and start to demand access to whatever it is you're testing sooner. So you need to have a policy, and that's, you know, the good news is we might be able to do that, and the bad news is it leads people who are dying or very sick or have these kids with these diseases to sort of line up not at post-phase 1, but sort of at the more precise, you know, animal model type thing. Not to discourage anybody from doing that, but it's just one of those, it's likely to happen sorts of things. But I think those are great suggestions.
Yeah, my name's Tim Schwab from Food and Water Watch. This is a question for Aqua Bounty. So your fish is advertised as reaching market weight in half the time as normal salmon, but this claim has been widely disputed in the salmon industry, who say that existing non-genetically engineered varieties already grow as fast or faster. And Aqua Bounty hasn't really responded to these claims beyond repeatedly pointing to the company data that you showed this morning, which does tell a different story. So certainly FDA did not investigate the growth rate claim you made this morning. As we heard yesterday, FDA is regulating your product as a drug and not a food, and as such, it has to regulate the effectiveness of the drug. And to do that, it did a very limited, narrow growth rate claim of up to 100 grams, which FDA says is the point which your fish can be transferred to saltwater. And then FDA says that Aqua Bounty is prohibited from production in seawater because of escape risks. So this really calls into question why FDA and Aqua Bounty chose this single, very limited metric for testing and did not meaningfully look at growth rates to full size. It's one of the many, many ways where the FDA review process seems to present more questions than it answers. Your benefit claim obviously is that your fish can reach market weight twice as fast as existing commercial lines of Atlantic salmon, so why didn't you test that? And as a bigger question, how do you expect your line of fish to be successful if it really is a solution in search of a problem, as one salmon industry representative called it?
Thanks.
I'm glad there was finally a question in that. Thank you. You've touched on several issues. First of all, this is the first product that went through that process. I can jump to the bottom line and say that I met 2 weeks ago with the heads of the largest salmon producers in the world, and they don't dispute our growth claims, nor do they dispute the performance of our fish. Some of the suggestions that you've made are very difficult to design for FDA purposes, even in this paradigm. And last but not least, we've been very transparent, have put our data out there, and some of the statements that you made are frankly incorrect, and you know they're incorrect. So I think that We've put our data out there. We've talked to the public. We've allowed the discussion. We've been transparent. And again, all we hope for is that we have the opportunity to introduce our product and let consumers choose.
Nothing I said was incorrect, but I'm happy to let the next person question.
And that's why we have the break. You can engage right there. We're going to do one more over here. Oh, did you want to get in on this? Oh, okay. Okay.
Yeah, Dave Anderson, University of Washington. I've had several questions from our virtual conference attendees. In the interest of time, I'll try and collapse them down into something fairly manageable. They really relate to the research community being able to monitor itself and make these decisions between what we can do and what we should do. And the questions really do go to Dr. Kaplan around your proposal that the IACUC be the focus for that. Essentially the callers wanted to know what specific recommendations would you put forward for an IACUC to be better composed to be able to handle these decisions, because with the workload and the current composition, many members feel like their IACUC really is not in a position to be making these decisions at present.
So just in the interest of time, although I really could answer that question about how to get the IACUCs on steroids, one idea is maybe we could have more regional or centralized IACUCs just to handle gene editing type questions as they come up. You don't have to have local review of everything. We're having a big argument about this in human subjects research in terms of centralization for certain types of studies. Certain forms of, certain membership things I think could be altered in order to give more of a public space. IACUCs aren't always transparent, letting people sit in or watch what happens. I might shift that for gene editing and just say, here's how we think it through, and this is what's going on. You might even set up a process by which people could appeal or ask for a reconsideration of something to the IACUC, sort of say, I heard what you did, but I think left out something or whatever they want to add in. So basically regionalize it, upgrade the criteria by which it's going to have to make assessments, educate them as to what is involved. Not everybody's a gene editor on an IACUC these days. And then try, I suspect, to make it more open. It's part of the way you develop trust in local or regional institutions. I think we heard that there's some growing skepticism about the legal regulatory out of Washington end, in some circles, not all. But this would be a supplement in a way. So I think you could build it, strengthen it along those lines. So who's left here? This will be our last one, and then we'll head out to the break. And tell us who you are again.
Okay, good morning. My name is Sylvia Singletary, and I'm from the Advanced Sciences Research Center in New York. And I'm going to step out of the scientific role and try to get more on a social level. Many of the communities that could benefit from this are are disenfranchised either by lack of access to the things that we all kind of take for granted. We all have choice in this room. So framing the question around social media and that the minority populations in this country don't trust, on average, science and feel that by default they might be the guinea pigs in this all. How are you going to bridge that gap? How are you going to establish that trust? Because a lot of those communities could benefit. I mean, I live in an area where it would be nice to be able to have more access to foods and things like this, and it's just not happening there.
Okay, last issue. Take a stab at that. Building trust in disenfranchised or somewhat historically skeptical communities.
Just one suggestion, and this is a really big, broad wish, but that public education from the get-go was better about science literacy, health literacy, and bioethics to a really large extent. I think that would do be a great service to every community to just enhance scientific literacy across the board. And then I think sort of the really practical suggestion to improve diversity, membership, voices, public opinions on whatever kind of governance structure is put in place, whether it's in the ICOOC or a regional model or something else, with a really big eye toward, diversity in all forms, I think would be important.
And I'll say this, Carolyn and I have been working at NYU for a long time on a high school bioethics website, just getting issues out to high school teachers, high school kids. But we noticed that a lot of the people who use it are the private school people, the advantage school people. So in STEM studies and other areas, you really got to make an effort to both design curriculum materials that fit the audience, if you will, and then make sure that efforts are made to engage them and supplement them with, if you're going to have a workshop, you got to help some of those folks get there and so on. So some of that is building, I think, ethics issues in for much younger people who, after all, are going to be making these decisions most likely down the road, whether they're disadvantaged or advantaged. But, the future of some of this gene editing technology vis-a-vis animals is going to be in their hands as it evolves. We've only got the first product approved now, so there's more assumedly to happen. All right, we'll take that break. Let's make it a full 15 minutes, but please be back by 1:15. And thank you. Let's give the panel a big round of applause. Thanks, Mildred.